everyone, and welcome to a special spooky Halloween edition of Bear Care Corner.
Very exciting.
My name is Andrea.
My name is Nicole.
And we are in our brand new newsroom, which we're going to be sharing a lot of time with you in.
It's our first Bear Care at the new property.
Yes, and we've decided this is our newsroom, so I hope you enjoy it. This episode is especially spooky. There's going to be some creepy crawlies. There's going to be some depictions of healthcare that might be a little grosser than you're used to. So just a heads up, if you're squeamish, this might not be your episode. If you like finding out about healthcare, then this may be your episode. We're going to go through a bunch of different pictures and talk about medical cases that we've had over the years, because we've been here for many years and we've seen
a lot.
Everything.
We've seen a lot.
We've seen a lot. So we hope you enjoy this episode for Halloween. First thing on the list, tails, pigtails. We've had a few pigtail injuries over the years, and this is one example. And this is
Abigail. Yes. So
this is when it was first injured. We've seen this type of injury on pigtails a number of times. Unfortunately, this is what it looked like almost day one. I think this might have been day two.
Pretty early on.
You can see the extent of the damage. We were able to heal this on site with the guidance of our vet, and also pain meds and antibiotics and everything. So bandaging and doing everything every single day to this. We're going to show you the progress and what that looks like. And what is that called? Granulation?
Yes, exactly.
My favorite word.
Yes.
And seeing that on a wound is like one of the most satisfying things.
Yes, like watching the progression of the wound healing.
Watching some granulation.
Look at the swelling going down as well. So I think they're not date stamped, obviously, but this is over the course of 2-3 weeks, probably, I would guess.
In between bandaging and then letting it air dry. Wounds usually get to a point when they want to air dry, and this was one of the last, not the final. Her tail looks different than this, but that shows you kind of the progression over time. And the granulation, if you just learned a new word today.
Yeah.
One of my favorites.
Yeah, really incredible part of like the wound healing process, when basically all that nice, bright pink, healthy tissue is growing in over what was a big open wound. So we're always very excited when we get to that point in the wound healing process, because that means things are going well. So yes, very exciting.
She's doing better than ever these days, but that was her journey. And this is an example of what happens with big ears. Sometimes one of the areas that pigs can kind of grab on each other, unfortunately, are tails and ears. If you see the rest of the body, there's not really anything to grab. But if
couple
they get
scratches
into a scuffle,
here and there,
sometimes with integrations, which are monitored, I feel like there's sometimes less kind of wounds and injuries during integrations because of this, because we're there.
Yes, exactly.
Pigs have extremely strict social hierarchy, so if they think they should be in a certain spot for bedtime or eating, sometimes other times, but those are the kind of the hotly contested times.
Yeah, they will defend that spot.
Yes. Or if they've decided they wanted to move up, like Ted with Ray recently.
Yeah. We see a lot of that, like when someone is pulled for stall rest and then they come back, and a lot of times members of the herd who are lower on the hierarchy will take that as their opportunity to be like, ooh, I can go higher now. So we see a lot of that around integration.
So that was one example. And then we are going into kind of face injuries and dental stuff. We did a whole dental episode a little while back. Also, welcome back. We were moving.
In case you didn't know.
I just realized we haven't done a bear care in about a month.
It feels like even longer.
I think it might have been a bit longer. I think our last episode was actually a dental episode, so if you want to look just at teeth, go back in time a little bit if you scroll back on our Facebook page under videos. But this is our first one back in a while, because we spent the last month moving, and we're going to spend the next few years unpacking.
Yes.
But we do have what we need. This is one of the stalls, but a few stalls down we have everything that we need in there in our medical suite, and it's getting all set up. But
very exciting.
Yes, enjoy the process.
Yes.
We'll be keeping you posted with resident care. But these are kind of going back in the files. Again, if you're, I guess you're not just tuning in, this isn't live, but just a bit quick warning. There are some things that come up that could be not for the squeamish.
Yes, viewer discretion advised.
Yes.
A little bit more kind of behind the scenes of kind of the nitty gritty realities.
Show all the time. Show the healed process afterwards.
Yeah.
Here we have Iona, and she had this issue twice. Is this the two different times? So that's one you can see on the jaw. And is that her again?
That's Braxton. That's a second facial abscess,
So I
actually.
had two.
Yeah.
Braxton had one.
Yes.
And it wasn't even dental related. You would
No.
assume it would be dental related. Ray had one on his throat too,
Yeah.
which we'll get to at the end.
Oh, yeah, we've got some of
He
that,
had
too.
Some interesting experience under sedation,
Yes.
but yes, facial wounds. We see this. We jump into action right away. Always our vets are on call for these type of things. and guiding us or coming out to deal with them. But yeah, really interesting facial abscess, which are healed up.
Yeah, it took a while, but I vividly remember finding that abscess on Iona's face just suddenly out of the blue. I was just looking at her in the pasture one day, and I was like, "Oh, wait a minute, what do you got going on here?" So
It
yeah,
was kind of hit. It was just under.
Yeah,
where
yeah.
you might not notice right away. Sometimes you see swelling. Sometimes you see them not eating. Or
yeah,
something,
or looking
but
unwell.
no,
But
I
yeah,
remember her. She was just, and then we had to figure out which antibiotic.
yeah, we jumped into action. So that was the first time. I think it happened again, but all is well now.
She's doing great. No more facial abscesses.
Yes.
Teeth issues, specifically as a tusk. We're going to get into some other teeth issues, but tusks, we keep them short by trimming them very frequently.
Yes.
But we've had a few that have just come out on their own, and that's
Yes.
what you're seeing here. Is this Ted's?
Yes, it was Ted when he was on stall rest. I remember like a year or two ago
It's
for
a very
some
rare time
hoof
to
cracks.
break your tooth.
Yes,
We don't
yes.
even know. Do we know how?
I think we assumed in the gate somehow. I think just the way that his teeth aligned, that he was able to get them caught in the
Hercules has
gate
done that
somehow.
before.
Yeah, exactly,
Yeah, Hercules
exactly.
turned his face really quickly and caught
Yeah.
his tusk. In these instances, I could think of at least 3 cases where there's been a tusk. It's usually the top one.
Yeah,
we don't
yeah.
trim the top ones so they don't need it, but sometimes they stick out in a funny angle. There's usually not much wiggle room to trim. There's not really a reason to do
Yeah.
it. But if they do break like this, you can see the edge of it being jagged. We want to make sure
Yeah.
that area that's in their mouth, when it's growing out, it's not rubbing against their gums and causing irritation. We also want to make sure that
Yeah.
there's no pockets that debris and food and stuff. is
Yeah,
getting stuck in. So we have to clean
yeah.
their mouth really frequently when that first happens, and then it grows out and it's fine.
Yes, yes. Yeah, and I mean, when Hercules, he had that broken tusk recently, and he loved it. He loved it when we cleaned his
Yeah.
mouth. Like, it was like his
He
favorite
always has,
Twice
even
Daily
before he
thing.
had
Yeah.
anything like that happen to him. I remember just
Yeah.
like coconut oil.
Yep.
Any attention that he can get, he loves. There's also something, we did include this in our dental episode, called teeth floating, which might sound like a very bizarre concept. Here's a quick video
cool.
of a sedated Escalade. Surprisingly, he is sedated in this video. They're using a piece of equipment to file down his molars. Very
good
interesting.
one.
Yes. I haven't seen that in a minute.
Yeah.
This one's a little extra gross, especially
Ooh.
people who are squeamish around dental things. That's me. I've seen it all, but something about dental things just makes me a little extra.
Yeah.
So Moose had fallen
yeah.
once ages ago, and I think his bottom teeth cracked into his lip a bit. So
Right,
that ended
right.
up being an on-site surgery, which was amazing. He didn't have to go through the stress
Yeah.
of going into the vent,
transport,
all that kind of stuff. So our vet at that time just came out, got him all stitched up right there, and then that was quite a healing process. I remember cleaning that area.
Yeah. Debris and stuff, making sure
I
it
think
stays
some of
nice
the
and
sutures
clean.
came out too.
Yeah.
So that's the kind of stuff you're dealing with when you're dealing with these kind of things.
Yeah.
I don't want to say frequently, but I've been here for just over 9 years. Nicole's been here.
6 and a bit years.
You see a lot.
Yeah. Oh yeah.
We can give you even more examples.
Yes.
Another famous tooth.
Oh yeah.
Not necessarily a spooky tooth. Well, you could be debated.
A little bit.
He's a bit of a spooky guy to begin with. The famous Obama tooth. I think he had this for about a year.
Yeah, we
going
are all
solo.
Yeah, we're
We're
so
just-
shocked it stayed for as long
And
as
it wasn't
did.
like, you could see it wasn't bothering his upper, like it was
No,
just there,
no,
and then
still
eventually it
eating.
just came out on its own.
Yep.
Goats and sheep especially could just start losing those teeth over time, but he does
Yeah.
have molars. Molars are really important.
Yeah,
The teeth are nice for
grinding.
grabbing the grass, but he still eats grass.
Yeah,
He's got a
shockingly.
hard palate and a soft palate, and he's still eating grass.
Yeah.
So
Yeah, he still does great.
more Obama, because we can't get enough of him.
Yeah,
His
he needs a special feature.
spooky
Ooh,
horns. So if you've seen pictures
yeah.
of him pretty much any time over the last feel like
2-3
more,
years, maybe
yeah.
longer. Yeah, it's been a while.
He's had his horns casted. So this was an instance of him having the casts. I think they were removed at this point.
Yeah, removed, because underneath the cast, like the
Pretty gnarly.
Yeah. Oh, that's a really good picture.
And that
yeah.
might have been a little bit of the quick being involved because they were really thin there.
Yeah, yeah. So there was the cast over top of the horn, but you can see what's there. Like the horn quality is quite poor. Yeah, very flaky.
And he's always had those kind of issues, so we're keeping them cast so they don't
Yeah.
get knocked off.
Yeah,
And he
for
does
his
like
protection.
to wrestle.
Yeah.
We just, that's his lifestyle.
Yeah.
And this is with his fresh casts.
Oh,
which if you look at him
yeah.
now, they're the same color as his horns, so they kind of blend in.
Yeah.
And then another funky goat sheep horn. This is a goat. This is Jeannie.
Yeah.
Kind of this. Was that her quick that was remaining?
Yes, this is as it was already healing. This is not like the freshest image, because those ones were like a little bit much.
A little too spooky.
Yeah. When
Even
the
for
whole horn
Halloween.
was knocked off and just the quick was left underneath the horn. Yeah.
Yeah.
That healed up nicely.
I don't even know how that happened, really. Sometimes these things happen. Sometimes they're older and they're just lacking in some nutrients or whatever. And you get flaky horns, they get flaky whatever. And it fell off. She knocked it off, and she was left with this little numb. She still has it, and it's all healed over.
Yeah.
So she has this funky little little horns.
It took a while, and that was something that again, like with our the help of our vet team, like definitely that was bandaging, pain management, antibiotics, because when that quick is exposed underneath the horn, it was extremely painful. So she had lots of pain meds on board to keep her comfortable. She looked very cute with her little horn bandaged as well. Yeah,
so cute. We're going to be back. We're going to take a quick intermission and show you some interesting and odd facts about some of the residents that we have here, and we'll see you back in 45 seconds.
Very exciting.
How many of those did you know?
Welcome back.
I think I knew most of them.
That's a lot of good stuff.
Little facts for everyone. We'll quiz you on that next week.
Yes.
Next, we have some chickens. Nancy has been kind of through everything you could think of since he's been here. He's beat cancer twice, and this was one instance of he had cancer on the skin right under his vent, like right on his bum, right under there. And they had to take a significant amount of skin off to get clean margins.
Right.
So what you're seeing here, I don't know if you can see, if you're watching on a phone, it may be hard to tell, along the edges of the incision where they pulled the skin back together, because it was so tight, they couldn't just do sutures. Do you remember what those were called? Not stents. They have a name. If you hear something, it's Hercules having some
There's some
argument
pig drama over there. No, I can't remember.
There's a name. So they look like straws. There's clear plastic tubes. The suture would go through. So those were pulling the skin together, not just the suture, because that would have been too.
Too much tension on like the wound and on the skin.
Yes.
Yeah, it was really,
that's
really
the first
neat.
time I'd seen that.
Yeah, me too, actually.
And he healed up really nice. We're going to show you the after photo. You can't even tell.
Yeah.
You can see a little bit, but I don't even know if you can still see that. His scar.
I don't think
line.
so.
I don't think I've seen it.
So.
No,
Yeah.
he healed up really nicely.
Yes.
So that was removed. I don't know if you can. You might, but because we're mic'd. Hercules is just.
There's some drama over there.
He's right beside that wall. Yeah, and he's had his wing removed. 2 surgeries, partial
two separate ones. Yeah,
full, because when they did the partial right about here, wasn't quite enough to clear the margins, which you want to do in a case with skin cancer. And then this is also him. He's had all kinds of feather, skin-related issues.
Yeah, his medical history is quite extensive.
Seeing an impacted feather follicle. Is that what we're looking at?
I think so, and I think this was on his wing, I think before the full amputation.
Oh, okay.
I think
this is how we started to see it. We started to see these feathers that would kind of fall out and just not grow back properly, and the skin wasn't good. And
and get impacted with like debris and infection.
and-
We went through like so many different cultures, antibiotics,
everything.
wound care before we finally got to the bottom of that. So yeah, it was, I think the biggest thing was just the wound that just never really healed no matter what we did. That was kind of our
Yeah.
biggest indicator of like, okay, there's
Yes.
something deeper going on here.
Yeah, because wound should always heal. But
Yeah.
if there's an issue like cancer, then there's
Right,
going to be
right.
reason why that's not happening.
Yeah.
Another chicken case. This is Holly. I think it was a little bit further on in her healing.
I think so,
She
yeah, because that
arrived-
looks really nice.
This is her entire back end with her little tail nub.
Yeah.
That does look really nice. It was looking a little much more raw when we first took her in. She was attacked by a dog. So that's what her back end looked like. A lot of those feathers were removed because of the surgery. She
yeah.
had numerous bite wounds. There was risk of infection, so she was on all kinds of care, and she was new to us, so she was on quarantine at the same time.
Yeah, we were changing the bandage every day.
It was
Yeah.
an awkward bandage.
It was, yeah.
You can't just stick a bandage on top of feathers, or
Yeah, it was like
a
the sticky-
Band-Aid where
Yeah. Yeah, it was like the sticky, like Tegaderm bandage. Yeah, that also healed incredibly.
well.
Yeah,
Especially with
very,
the
very
area that it
well.
was in. I think a little bit was under her vent too.
Yeah, that healed really, really well.
I'm very lucky for her. She's doing amazing these days.
Yeah.
All those feathers have grown back. Sometimes when you see that, you're like, oh my gosh, she can be like that forever.
Yeah.
Nope. You can't even tell. You
Yeah.
wouldn't even. I forget sometimes until I saw this. I kind of
Yeah,
forgot
I know, me
that
too,
she had been through
actually.
that.
Yeah.
So we have chicken feet issues. Chickens get
Yes.
issues on their feet. What is this one?
Yeah,
I know
so
what this is.
yeah, I remember this is Walter, who was part of the Farm X group of birds, and many of those birds had bumblefoot and scaly leg mite. So Walter was dealing, I think, with both in this
Which are
image.
both- I think scaly legs are quite uncomfortable, and then bumblefoot can be painful. So
Painful,
it's just like a
yeah.
mix. When they're not kept in sanitary conditions, when they're not given proper perches.
Yeah.
I think bumblefoot, scaly leg mites. Scaly leg mites are kind of mites in general, and I want to get started on that right now.
Yeah.
Can be really hard to get rid of.
Right.
So part of it was wrapping. There was a lot of different things. That's why some of the scales, I don't know if you could tell, but they're kind of lifted up on her feet. That's one indication that
Yeah.
there's scaly leg mite.
Yeah, the
there.
redness too.
Yeah, irritation.
Yeah.
And then another example, a bird from that same.
Yeah, Gregory, I think he had very bad
Chronic.
bumblefoot. Yeah, chronic for
Chronic,
as
yeah.
long as he lived here as a result of
He
that.
had some deformities in his feet that
Yeah,
didn't help with where he was putting pressure.
Yeah.
So you can see here his feet were quite funky. We were pretty much dealing with his feet every day.
Yeah.
I don't think there was any days we weren't dealing with
Yeah,
Gregory's foot,
yeah.
getting foot bath.
Bandaging.
I see a
yeah.
syringe full of betadine in the back.
Oh yeah.
Telling.
Yeah, there was a lot going on there. Yeah.
So that was from improper housing as well. He didn't have a proper perch, and he got some deformities over time on
Yeah.
his feet.
And he was a pretty big bird too.
He was a big man.
Yeah. So there was a lot of weight on those feet, and which were
doesn't
already
help.
rough to begin with. Yeah.
It's tricky. Those are bumblefoot's tricky.
Yeah,
Can be
but
really tricky.
thankfully, like there was that group of birds that, like Jean Leclerc too, his feet were pretty bad too. Thankfully now we haven't had bumblefoot that extreme really since those big intakes. I would say, thankfully.
Usually, sometimes when they come in and they have really bad case of bumblefoot,
Yeah.
that can take a really long time. Sometimes it could even require surgical debridement.
Yeah.
That's the kind of extreme side
Yes.
of the healthcare to it. So, one of an interesting case, I remember picking up Dorothy one day
yeah.
and feeling kind of crusty on her leg, and I assumed like there was some dried feces in her
Right.
mixed in with her feathers. It was a weird feeling, and I kind of was like moving it around, and it ended up being like a really crusty, kind of keratin-like.
Yeah, like a weird growth.
Really
Yeah.
embedded in her skin.
Yeah.
And we're like, what is this? Like, we're not dealing with this on site. Like,
No,
we didn't have
definitely
the
not.
tools,
No.
The knowledge. We don't have a surgical site. So we brought her into the specialty vet, and he removed it really nicely. Like, that came off, and he was able to get those nice sutures on.
Yeah, and it was just like a benign, I think it was spindle cell tumor, I think. Don't quote me on that, but I think that that's what it was. Basically just like a benign skin tumor. Yeah, because we ended up having it biopsied, of course, just to make
Always
sure we
wanna make
knew what we were dealing with.
Margins,
Yeah.
and she healed really well. She had like just a few, I probably count them from here, how
Yeah.
many sutures. And this funny photo that I found after, it's a whole video. I'm not going to show you the whole video, but every single time I snipped, sometimes we can take out sutures on site if it's safe. We did with this case because it was very surface level.
Yeah.
It was very easy. No risk of infection. It healed perfectly perfectly. Every suture I snipped out, she bit me. So
It's very on brand for her. She's a sassy
which
lady.
is great to see because that means she's feeling good as well.
Yes,
So
absolutely.
Bite
Yeah.
every single. I was just laughing the whole video.
She's really cute.
This is Nicole's favorite section. I don't want to speak for you, but it's Nicole's specialty, one of Nicole's many specialties.
The creepy crawlies.
We are now in the creepy crawly section.
Yes. So be warned.
Are you going to tell us what we're looking at in each one of these? There's 4 of them.
I think so. I don't really remember what I put in here, but let's see.
It's just some gross stuff.
Yeah,
right?
yeah. So this one, I don't remember if this is from, no, this is from a goat or a sheep. I can't point, but the thing that's not like the dark circle, that kind of oval brown.
So those dark circles are
air bubbles, exactly.
And this thing that's kind of like a seed.
Yeah,
like a watermelon
Yes,
seed.
exactly. So that is the egg of a whipworm. It might have actually been in the most recent time we had whipworm was, I think, when the baby goats were still on quarantine, so Zoe, Pixie, and Hazel. So I think that's from their fecal testing earlier this year.
So
they
this is
had
a fecal test. You
Yes.
put it under a microscope and you
Yes.
count how many of those eggs.
Exactly.
This fecal egg count. Is this an egg?
Yes. Ooh, that's actually a pretty good one. Yeah. So also
clear
from
image.
Yeah. So that's also from a goat or a sheep. That's kind of just a generalized general GI worm, like a bit nematode, basically GIN. Very, very common in goats and sheep. So something that we monitor in their fecal testing.
Very frequently have, but the only reason you test or not test, treat is when the amounts are higher.
Yes,
right?
if they're high or if they have like an underlying illness. So for example, like Diablo or Gilbert who have underlying disease of CAE, we tend to keep a closer eye on them just because they have some underlying disease that might make them more susceptible to the effects of like a higher parasite burden.
What is this? That's not an egg, is it?
No, I actually have, it's some kind of a mite that just so, I actually don't know
I can
what.
see the legs.
Yeah.
So it shouldn't have been in there?
No, I mean, it was just an incidental finding, like that just so happened to like be on that
Kinda
piece
cuddly.
of poo. Yeah, like they're kind of cute, but yeah, just an incidental mite of some sort.
Sounds like the moon.
Yeah.
Oh, I see one of each.
Yes.
So this first 2 you show.
Yes.
I can ID
yes.
that.
Yeah.
You'll be quiz next week.
Yes, exactly. Yeah, so you got your GIN and your whipworm in there.
One of each.
Yeah. That was quite exciting.
Wow.
But I mean, it's nice that there's only 2 in that view because we've definitely had some fecal tests on site where in a picture like that, like of that view on the microscope, you'd see 20, for example. So that's
Not ideal.
That's not too bad.
Okay, enough for the creepy crawlies.
Yes.
This was kind of a one-off case. We have pouty face here, and this was
yeah.
after his on-site lipoma. What do you call it when you?
It was the punch biopsy,
Yes,
right?
biopsy.
Yeah.
I don't know if that was punch because that was a lot of equipment for punch. Maybe I'm wrong.
Maybe
He had
that was
2.
the
He had
second one.
punch,
This
and then
was
one that was a little bit more
deeper.
which
Yeah, I
looks
think you're
like
right.
That's where this one's headed.
Yeah.
And we were able to do that on site, luckily, without having to transport him. So there's a few biopsies done before we knew it was a lipoma.
Yes.
We wanted to
yes.
determine what was going on. He has this kind of big lump on his neck, which hasn't changed in many years.
Yeah, thankfully
Yeah.
it's stayed the same. Something that we
Yeah.
keep an eye on during
That's
his health
something
check.
that we would
so-
consider doing something with if it was impeding.
Yeah,
no, neck
eating
motility
or
needing-
movement.
yeah, but
yeah.
it's not, and there's no reason to remove it or put him under for surgery because that would be very extreme in that
Yeah,
case. So
yeah.
that's him being very brave.
He was very brave.
He had a
that
lot
day.
of local anesthesia.
Yes, and many treats.
And many treats.
Yeah.
We'll take that off. That's a little. This is interesting. We're getting into some eyes. If you're squeamish about eyes, this is not your segment.
That's a thing for some people.
Yeah,
Yeah, the eyes
I'm
are
the
kind of
dental.
weird.
I
Yeah.
don't like the dental stuff. We have
Oh,
Florence,
Florence.
and this is post-op.
Yes, yeah. So that was after her
Those nice
eye
little
removal
sutures.
surgery. Yeah, that healed up really, really nicely too.
Yeah, you couldn't even tell that there's no scarring after they.
Yeah.
Is it called evisceration?
Yeah. So
Not a great word.
Yeah,
they
'cause-
eviscerated the eye.
Yeah, because she had an evisceration versus an enucleation, because the enucleation is actually removing the entire eye, and then the evisceration,
Yes.
if you want to get into the details
Might
of
as well
it.
it's a Halloween
Yeah,
episode.
because with the evisceration, basically they leave like the structure of the
Yeah.
eye and just kind of.
I didn't
like,
even know they could do that.
Me neither, especially not in a bird, but they basically
so
kind of just
small.
like suck it out, right?
Yeah, take out the contents because that's the stuff that was causing her issues.
Yeah.
And she had to have that removed because it was starting to cause her a lot of pain.
Pain, discomfort,
It was
yeah.
very kind of Yeah, I don't know if it was swollen. There was just it was not. Yeah, they
'Cause she
determined
had-
that was the best course of action.
Yeah, she had the irregular pupil. Yeah.
So and then she was much more comfortable after that.
Yeah.
That's right after
Yeah.
one eye. And then we had a very long case of eye issues with our boy,
Yes,
Sir Denver. This was
yes.
about 3 months, at least, probably 3 months over the summer.
That was a wild
You can
time.
really see how irritated, infected, the cloudiness.
Yeah.
Even in the picture where he's further away, you can see him
The
squinting
swelling,
and
yeah.
swelling with the left eye. And then something we did for treatment, which Nicole did. What is this?
Yeah, so that was super cool. So we, over the course of his eye injury, under the guidance of our vet, we did cultures of his eye. He had the ultrasound of his eye. We tried so many different medications.
Pressure test,
Yes.
different antibiotics,
Yes.
different eye drops.
Yeah, very, very, very involved treatment for him, which thankfully, good news. He has kept the eye. It's healthy enough. He can't really
Have a
see out of
slight-
it, but
yeah, it definitely has some vision loss, but not 100%. I don't
Yeah.
think, because he reacts a bit.
yeah, so he got to keep the eye, which is excellent. But part
No
of
surgery.
so part of the treatment was that we actually pulled some of his blood on site, and then we actually used the serum from his blood. So basically the liquid portion of his blood that contains contains like proteins and nice things that basically can kind of help stimulate healing. So basically we pulled his blood, spun it down, and then used that liquid portion as eye drops. And this is something that's like pretty frequently used in like cats, dogs. We've used it for rabbits as well, for
yep.
Terry. So this was something that we tried with Denver. So that was part of his care routine as well. Yeah, very cool.
Didn't know you could do that. Nicole can take blood on site.
Yes.
Getting our equipment all set up.
Yes.
Speaking of Denver, we're going to talk about a few hoof issues we've seen over the years. We've seen many pigs are prone, but also cows can get something like this.
Yeah.
I think there might have been some irritation too between the toes, or some redness.
There's a lot
and also
going on
you can
here.
see that lateral, which is the outside claw, having a lot of defect on it. He would have had his hoofs trimmed pretty soon after this, I think.
Oh, yes. Yeah.
But it was looking pretty funky for a while, and you want to
Yeah.
maintain the integrity of the hoof. That's super important. Get a proper farrier, and do that frequently, especially for somebody like Denver who's older,
Yeah.
prone to ulcers.
Yeah, and he's someone who really benefits from his regular trims. Like you can tell how much better he feels after having his hooves trimmed.
like a
So,
baby.
yeah.
And then we're going to get into some pig. These are only a very small sampling. We've had so many issues with pig hooves. We've added so much to their diets over the years with supplements, but they're just prone because they're so big on these little tiny feet. They get hoof cracks, they get hoof abscesses, and that's just kind of the external stuff. They can also get things like arthritis, or they can get a mix of all those things. That's one example.
seen it all.
I think that it looked kind of like not that severe, but it ended up being quite kind of raw and painful for a while, even something such a small little spot.
Do you remember who that was?
I don't remember. Bobby.
Bobby or a
wanna say
Dan,
Bobby
maybe.
on that
Yeah,
one.
I remember those soft spots
Yeah.
underneath. So you definitely don't want to be seeing those soft red spots underneath. They're very painful. That's when we tend to see like infection
Stones can
underneath.
get in there.
Yeah, exactly.
So that
Yeah.
would have required, I don't know, well, probably everything. We normally do bandaging and all kinds of things.
Yeah.
This was interesting. Was this Oksana? I want to
Yeah.
say because there was a toe cap.
Yeah. Or was it Bobby?
No, it's the
Oh.
color.
Yeah.
Well, I remember Oksana's hoof looked pretty
Yes.
bad.
Yeah, I think that was Bobby with her toe cap. I remember she had a
She
lot
had
going
toe
on
cap,
too.
the
Wow.
integrity of the hoof there was really struggling. Cleaning that out. So that was one example. She must be in the pig chute.
Yes.
For that. 'cause
Yes.
looks like she's up off
Absolutely.
there. I think all of the rest of these are.
Yeah.
Cracks underneath. So often we're seeing cracks, kind of a lot of those that run down vertical, but these ones underneath can also not be great.
Yeah, and I mean, like a crack that size is definitely something that a little stone can get lodged in. So many times, and that can really cause a lot of issues going forward. So when we do our hoof trims and health checks, that's something we keep a really close eye on. So whenever possible, if we find a crack like that, we like to smooth them out as much as we can. Really kind of get in there, see what we're dealing with, and just kind of smooth it out as much as we can and
check them frequently.
Yeah.
This one's a pretty bad one. This is resolved since, but going all the way up to the coronary band, which is essentially the cuticle where the nail bed grows from, the hoof bed. that splitting down underneath and then up the side is quite severe.
Yeah.
Would be a bit painful. You could see that we would smooth it out. We have, like with a Dremel or with another tool, to start to make it less like of a big, I don't know,
like a crevice basically, because we
Yes.
don't want it to be trapping like bacteria, dirt, debris that can
They
kind
love
of
to collect that
yes,
stuff.
exactly, stuff that would cause infection. So we try and open them up as much as possible, or depending on the case,
as
they're
they
all
grow
unique.
down.
Yeah.
Something like that would take maybe 8 months to grow out.
Oh yeah, some of them take so long.
And some of them continue if they start to crack at the coronary band. Sometimes they continue to crack there because
Yeah.
it's already. That's a really tricky case. I don't know who this was. They're fine now, but like,
Yeah,
that
yeah.
would have taken almost a year
Yeah,
to
I think
heal up properly.
there was a period of time where there was a couple pigs who had cracks like that. I think like Ted and Oksana for sure. I vividly remember because we saw the same crack on at least 2 pigs around the same time. We were like, oh my gosh.
Yes, it's a lot of work. They have a lot of
Yes.
feet, and they're very prone, unfortunately, to
Yeah.
hoof issues. This one, I don't know if you've been looking at it for a sec. Maybe you can see
Yeah.
the issue. We don't have a crack, but we have. Would there have been an abscess?
I think so. Yeah, that was a
I think
pretty
that one burst
decent
out.
amount of swelling.
You can see the swelling
Yeah.
again at the coronary band. That's sometimes where they kind of can get those issues.
Yeah.
Sometimes they blow out in different areas, but this one, that's the picture. And then we also do thermal imaging to
Yeah.
that shows. You can see the whiter area is
Yeah, the heat, yeah.
the heatest, the hottest area, and that's exactly where that was. So heat is a good indication of
Yeah.
inflammation and infection.
Yeah.
So that was the spot we were really concerned
Yeah,
about.
and that's such a good picture too, the one of the swelling, because you can see like the loss of hair and how tight and shiny the skin
Yeah,
is too,
kind
like
of
it's getting ready to
red.
burst,
Yeah.
which is kind of gross, but it's exciting for us because we know, okay, like
Starting to
things are
drain.
starting to heal and drain, exactly, so we like to see those things.
Weirdly excited.
Yeah.
This is another
Ooh.
one. That one's pretty nasty. And then also
Yeah.
having some blood too, which is
Yeah.
pretty rare, like when you're dealing with hip cracks and stuff. But
Yeah, I think I remember. I think this was Braxton, and this was last winter, so there was ice outside. So I think she already had that crack to begin with that kind of started to compromise the integrity of the hoof. And I think that she got like a little shard of ice or something in
That
there, and I
makes
think that
sense.
that's why the blood
and
was
there's
there.
kind of like a flap too that might
Yeah,
have peeled back a bit.
yeah,
so.
exactly. Yeah, that was a big one, but
one's healed up,
it has
but-
healed up very nicely.
When you first see it, you're like, oh my gosh.
Yeah,
And
yeah.
there's stuff, supplements we do to help avoid these, but it's just
It's just
they're-
part of our
one of those
management. Yeah.
things that they're prone to. Like when you have hens, they're prone to reproductive disease. Pigs are prone to arthritis, earlier ages, and hoof cracks and things. One thing that we are scared of, if we've shown you enough things that you might be scared of, one thing that we're scared of, worrisome around, we're not very excited to do is sedation on larger animals, especially
Yeah.
pigs. We've done a few on site and we've done some at the vet.
Yeah.
Pigs don't love to come out of sedation really well. So we had an example of Ray. I mentioned earlier that
The
abscess on his
abscess,
throat,
yeah.
which he had to be sedated. He had to have cleaned out properly, and we're able to do that on site, which saved the stress of transport.
For sure.
But he didn't come out of sedation super well.
Yeah, it
so-
was a bit of a rocky recovery.
yeah, he was very active, and then he just went down. There was no in between. There was no getting sleepy.
Yeah.
And coming out of it was really tricky for him. So we have here, it's called the bear hugger.
Yeah.
So that's a warm air that's getting pumped into kind of these blankets that are on top of him. These covered nether blankets. He's being supported.
Yeah,
so we want
with
to
the
get
bales.
him. Yeah, we want to get him in case there's any vomiting or anything. So
Yeah.
that was a tricky afternoon. He didn't
Yeah.
come around.
Yeah.
But yeah, you never know. Like sometimes you'll have a sedation and nothing happens. And
Right.
sometimes you'll have other ones where it becomes difficult.
Yeah.
This was
Oh.
Leona.
Yeah, that's after her second facial
Yes.
abscess, which you may remember from the earlier in the video. But yeah, that was after the facial abscess came back for a second time. And I think at that point we were wondering, okay, is there something deeper, like dental involvement
Yeah, and that's
here?
what we were checking on.
Right,
because I think
right.
it might have also been closer. Or, you just
Yeah.
never know. And you can't really reach your hand on a pig's mouth.
No.
Check for dental stuff. We really don't want to do that with anybody.
Right.
Even like goats and sheep.
Yeah.
But she had a bit of a rough moment, rocky moment in her sedation, but she recovered well. And
Yes.
This is kind of her recovery position.
Yeah.
And then that's our pulse ox,
Yeah.
which is keeping her vitals
Yeah.
in check. Like,
Yeah,
we can
because
see them.
she was sedated for X-rays, like dental X-rays, basically, so we can kind of assess if there was anything else going on. And I don't think that there was, right? No, it was just
All clear, just
just
getting
a
those
really
facial
persistent
abscess.
facial abscess, and that was years ago, and it hasn't come back. So we're thankful for that.
Yes. One example, and this wasn't even sedated. On site.
Oh, yeah.
And on site, I wouldn't call this a surgery. It was just a suture,
Yeah,
stitch up,
wound repair.
Wound repair. Tim was involved in integration where he had an injury on his neck
Yeah.
and needed stitches for it. We gave him gabapentin for pain relief, but the gabapentin, with the mix of adrenaline of the fight that happened during integration, actually put him completely out.
Yeah, it took the edge off.
This was a video, but I didn't include the video with the audio. But that was kind of like, not joking, but just saying that she can't wait to tell people that she stitched up a pig that was not sedated. Like he wasn't technically sedated, but he was just getting a belly rub. Like he was like, very relaxed.
Yeah, he's a really good boy.
Local anesthesia again.
Yeah,
and
pain
pain meds, and he recovered super well.
Yeah, and he healed beautifully as well. We kept it bandaged for a while.
Keeping it clean,
yeah.
Important.
Yeah.
Our last segment for today.
Of things that
Eggs.
scare us. Yes.
One thing that we keep a really close eye on that we always want to make sure that aren't scary are eggs. If
Yes.
you ever look through our secret stash of healthcare photos,
Yeah.
you'll find a folder of just eggs. And these are not completely normal. That's why we've documented
Yes,
them. We always make sure that if we do find eggs that the hens are laying, which is kind of rare because we keep them implanted, but once the implant wears off, we do give them another hormonal implant to stop laying. But if we ever see anything that's abnormal, you can see kind of wrinkly texture or anything that's off, we want to make sure that they're getting enough calcium, that everything's going okay, because things can go badly with the reproductive system.
Something we're very mindful of. Yeah. So those were some not horrifying eggs,
This one
but
is the scariest egg.
oh yes.
So this was
oh yeah. Do you remember
scariest
who that
photo to
was?
us.
It was definitely a duck. I remember.
I think Elaine had some.
Was it Elaine? I don't remember, but
it ever had funky eggs.
I don't remember, but it was definitely a duck, and basically,
it was like almost a water balloon, but had like a little bit of crunch on the. You could barely touch it, and it kind of crumbled.
I think I just like put my thumb into it, and it caused that big indent there. So basically, the shell didn't form properly. That one.
That could be lack of calcium. That could be a few different things going on, but we're very. Always wanting to make sure their eggs are good. So
yes.
I hope you enjoyed our Halloween episode.
Yes, I hope that it wasn't too scary or spooky for anyone.
Uncover your eyes now if you've had your eyes covered the whole time.
Yeah, and I mean, if you did watch the whole video, that's incredible. Thank you so much.
At the end, that's amazing.
Yeah, please share your feedback. If someone's like, oh my gosh, I need more of this, like, we're ready.
We're going to be talking to you about this kind of stuff every week. Coming forward, we're going to do Wednesdays, but today's Halloween, so we're going to do Thursday. Let us know if you have any questions in the comments.
Yes.
We'll answer them on the next Bear Care Corner, and look forward to more interesting behind-the-scenes animal care stuff.
And I guess like special shout out to everyone for supporting us and like letting us provide this incredible level of care. So thank you so much for believing in us, and for helping us provide this care, because it's incredible.
Best.
Thank you so much, everyone. Happy Halloween.
Bye.